Hello, the information provided in this video is for educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other healthcare provider with any questions you may have regarding a medical condition. Hello everyone, I'm Dr. Shalak Manjal. Welcome to my channel. Today we are going to discuss dissociative disorders, a complex and often misunderstood group of medical health conditions. We'll cover the definition, core deficits, epidemiology, pathogenesis, evaluation, and both non-pharmacological, which is non-medication based, and pharmacological, medication based treatments. Let's dive in. Dissociative disorders are mental health conditions characterized by disconnection between the thoughts, memories, feelings, actions, and identity. The disruption can affect a person's sense of self and their perception of reality. The main types of dissociative disorders include dissociative identity disorder, DID, dissociative amnesia, and depersonalization or derealization disorder. The core disorders are these three, and what they involve is the core deficits of memory, identity, and perception. As for the memory, the patient has significant gaps in memory for personal information, events, or periods of time. As for identity, they have a fragmented sense of identity, often seen in DID, where multiple distinct identities or personality states are present. Perception can also be altered, particularly it's a distorted perception of oneself or environment, such as feeling detached from one's body or surrounding. Dissociative disorders are relatively rare but can be more common in clinical settings. DID generally affects 1.5% of the general population, and these are often associated with history of trauma like PTSD, particularly in childhood and also in women more than men. The development of dissociative disorders involves both genetic and non-genetic factors. As for the genetic factors, these are substantially linked to dissociative symptoms. Some of the genes that regulate serotonin, dopamine, and other peptide transmission, as well as genes that are involved in neural plasticity and cortical receptor sensitivity, can influence dissociation. As for the non-genetic factors, some of them include trauma, physical, sexual, emotional abuse during childhood or presently. Stressors like war, natural disasters, and severe neglect can also contribute to this development. Generally, when I have seen these disorders and these symptoms in my patients, they've happened in context of PTSD with some kind of history or present occurrence of physical, emotional, or sexual abuse. As for the evaluation of dissociative disorders, these typically involve clinical interviews, psychometric tools, and physical examination. The clinical interviews help understand the patient's history, symptoms, and any traumatic experience like physical, sexual, emotional abuse. Psychometric tools are use of standardized tools such as dissociative experience scale, dissociative symptom scale to assess the severity and nature of dissociative symptoms. Physical examination is also integral to rule out any medical conditions that might cause similar symptoms. The non-pharmacological treatments are cornerstone of managing dissociative symptoms, and these include psychotherapy. Various forms such as CBT, DBT, and eye movement desensitization and reprocessing, EMDR, are effective in addressing dissociative symptoms and underlying trauma. Hypnotherapy, used to access and integrate dissociative parts of self, can also be used. Supportive therapy, building coping skills and providing emotional support to help the patients manage their symptoms, can be quite useful as well. While there is no medications that specifically are approved for dissociative disorders, medications can still be used, such as antidepressants, to treat the co-occurring depression, anxiety, and PTSD. Antipsychotics can also be used for severe symptoms or comorbid conditions like psychosis. And mood stabilizers such as lamotrigine could also help in this issue by helping with mood regulation. To conclude, dissociative disorders are a complex condition that require comprehensive approach to the treatment. With the right combination of psychotherapy and medication, individuals can manage their symptoms and lead a very fulfilling life. Thank you for watching. And don't forget to like, comment, and subscribe for more mental health content. Stay healthy and take care.